What are the ethics of cognitive assessment technologies for dementia? When we think about cognitive assessment technologies for dementia, we must consider the ethical implications involved. These technologies can include digital tools, artificial intelligence, and other devices designed to assess cognitive function. However, the use of these tools raises important questions about privacy, consent, and the dignity of individuals living with dementia. One major ethical concern is informed consent. People with dementia may struggle to understand the implications of assessments due to cognitive impairments. This makes it crucial to evaluate their ability to provide informed consent. In cases where individuals cannot fully comprehend the risks and benefits, involving legally authorized representatives or caregivers becomes essential. Consent should not be a one-time event but an ongoing process, allowing individuals to opt out if they choose. Supporting their decision-making is vital, even if their ability to do so diminishes over time. Privacy and data security are also significant ethical considerations. Cognitive assessment technologies often gather sensitive personal information, sometimes continuously. It is important that patients and caregivers are informed about what data is collected and how it will be used. They should have control over their information, including the option to withdraw consent. Developers must implement strong safeguards to protect against unauthorized access or misuse of data, especially given the vulnerability of individuals with dementia. Another key point is the accuracy and communication of results. These technologies can produce complex data that may be difficult for patients and even some healthcare providers to interpret. Ethical practices requiring that results be shared in a clear and personalized way, taking into account the individual's cognitive abilities. Misinterpretation can lead to harmful decisions or stigmatization, so it is crucial that technology complements, rather than replaces, thorough clinical evaluations. Respecting autonomy is also essential. Individuals with dementia may face situations where they are assessed or monitored without genuine consent. Ethical frameworks stress the importance of avoiding coercion or surveillance without agreement. Technologies should not restrict freedom or privacy unnecessarily, and any monitoring should balance safety with respect for dignity. Involving patients and caregivers in the development of these technologies is another ethical necessity. Their insights can help ensure that tools are user-friendly and meet real needs. Engaging them in the design and testing phases can prevent distress or confusion. Lastly, compliance with legal and regulatory standards is essential. Technologies must adhere to laws regarding health data and patient rights, particularly for those with diminished capacity. Ethical use aligns with professional guidelines that emphasize confidentiality and respect for individuals. In summary, the ethical considerations surrounding cognitive assessment technologies for dementia focus on informed consent, privacy, clear communication, and the involvement of patients and caregivers. While these technologies hold promise for early detection and monitoring, they must be used thoughtfully to avoid harm and maintain trust. It is always advisable to consult healthcare professionals for personalized guidance in these matters.